Thank you for coming to the second meeting. I'm going to turn it over to Cindy Van Ast, and she's actually the M3. I would get back to M3, right? Rep. She's the broker that helped work with the consortium, not only forming the consortium officially through the state process, but also through the bid process. I'll turn it over to Cindy.
Good afternoon. Thanks for coming this afternoon. This was a little bit like church. Everybody's in the back row, right? Appreciate you taking the time. I was not here last week, Tuesday, when part of my team at United Healthcare came out. And I know that Joe and the team explained to you we weren't fully ready to do the enrollment meeting for you last week. And the intent really was to arm you with some information to help you feel confident about this change. Since then, there's been many more questions, and hopefully we'll answer them tonight. The real focal point of this presentation tonight is to walk through what are the options, what does the Navigate plan really mean, how does it work, what's that whole referral system, and what is the Choice Plus plan, how does that work. Now, I know there are some retirees in the group tonight, and some of you are what's considered a direct bill retiree. I want to make sure you feel completely comfortable that while we do not have all of the answers for the direct bill retirees, you absolutely have coverage. There is not pre-existing attached to it. And within the next week, you'll have the information, the rates, and the plan that's available to you. If you are a direct bill retiree that is over 65, you actually have a choice whether or not you want to stay with the WEA or look at what United Healthcare has to offer. If you are a direct bill retiree, you also have the opportunity to have the voluntary vision program and voluntary dental program. And that'll be covered very high level today. I know you heard some of that last week. So the focus really is to make sure you feel comfortable about this transition, what's happening, and what's happening if you're in the middle of a care cycle. So with that, I'm going to turn it over to Chris Ekas from United Healthcare. And I also want you to know we're capturing all of your questions, and you will start to see a weekly frequently asked question list that we've created from all the different districts and the questions that have come up and what are the answers. You may find someone had a question you hadn't thought about, but maybe it pertains to you, and it'll arm you with some answers. Okay?
Thanks, Cindy, and thanks again, everyone from the district. I'm back from last week. So as Cindy and Joe laid out, we're looking to, and they've asked that I stay here at the podium so that we can, I guess they're filming us. So again, thank you for the opportunity to come out. We have a more structured story here about helping you understand the expectations from United Healthcare. And as I mentioned last week, I want to reiterate today, we are thrilled to have you as our newest customer starting on January 1st. We're very pleased to be working with the entire consortium and co-op, and really are pleased with our association with other districts around the state and the work that we've done for those districts. So I'll get right into this, and it'll look very similar to what we had last week, but it'll be good in the sense of as a refresher, and of course there's some very important information that we didn't have for you last week that we'll now be able to update. So the agenda will really be, again, to welcome you here, as we've done, to United Healthcare. We'll focus a little bit of time here on what the financial impact is, and your contribution in terms of for your coverage, some of the changes that are in the plan, get into the network, pharmacy, and some of the features, and then at the very end we'll review what we discussed last week in terms of some of these specialty coverages. So here it is financially, making sure that this shows up so that you have a sense of what this represents. Obviously to the left there are your current rates. These are on a monthly basis, not per paycheck and not annually. These are the monthly rates that are being paid today to your current carrier. That is the contribution that you make as an employee. The yellow highlighted area will be what the contribution will be with Navigate, which is the referral gatekeeper model that we're presenting to you. And then you'll have the opportunity to have a buy-up to the Choice Plus model, which gives you the out-of-network component and improvement to what you have today. So that's how it represents financially, and as you see there in the highlighted area, the Navigate numbers are very appealing, represent savings for both the district and for you as employees. Choice Plus available to you. The district will make, and the consortium will make the same contribution that they would make to the Navigate program, and you have to buy up the additional premium, and that would be your total contribution. Are there any questions about the financial impact? We'll move into a little bit in terms of plan changes. We discussed some of these last week. With the United plan, there will be no out-of-network co-pays. And of course, if you're in the Navigate program, there won't be an out-of-network anyway. An important point here is the office visits are co-pay only. Currently, the arrangement is office visits are deductible co-insurance and co-pay. With us, it will just be the co-pay. From a pharmacy standpoint, we do not offer that value drug plan, so there is not an option for the $0 copay, but with the drugs that are on that $0 plan, as we discussed last week, all of those drugs are available through the Walmart and some of the other programs that exist out there for a Shopko, where you have a $4 generic drug. Our mail order is slightly different from what you have today. Our mail order will be 2 1/2 times copay versus 2 times for the 90-day supply. We brought up last week that the drug list will be different. Anytime you make a change, there'll be a difference in the drug list. We'll go through that again. You would need to know, if you're looking up anything on a network, what the name of that network is until you're actually enrolled with us. And so the Choice Plus or Navigate are 2 terms that will be important for you to identify when you're looking up a provider on our website. We mentioned the eye exams built into the medical plan. So if you use a network provider for an eye exam, you have one covered for every 2 years. A single exam, and then the value-added programs that we have, the Care 24, the Nurse Line, the discount program, some of the others that we mentioned last week that we'll run through again here today. So the theme here is that they're similar plans, but they're not identical to what you have today. And of course, if you're in a Navigate plan, as we see here, then you have a different structure than what you're accustomed to. But similar to what you have seen maybe several years ago, where you have a gatekeeper, which is your primary care physician, that you have to assign with your enrollment, and that primary care physician is really responsible for directing your care. So you will select, and as every member of your family will, a primary care physician, and as you move through the care system, they will be the gatekeeper for your care and provide you with referrals to specialists.
Chris?
And we've had a lot of success with this program here in Wisconsin, around the country, yes.
Chris, just so people know, it has to be a physician, it can't be a PA. Because I know some
Yes.
people use PAs and you can't put the PA, you have to put the PA's referring doctor down.
And the point he was making, if you didn't hear, is it has to be a physician and not a PA. So we have some, we have some forms that we left here last week at the district that will need to be completed. They're very simple. What you do is you identify a PCP by an MPIN, it's called, and with that MPIN, you just write down that number and the name of who your primary care physician would be. And our network, as we discussed last week, and I think I'll be able to go out to it today. Last week, it said our site was down, and actually as I found with some other districts, there seems to be a timeout situation here. So I think I'll hold it off and go out to it a little bit later, and I'll show you how simple it is to go out to the website and find some positions, and to identify what we call their MPIN number, so that you can write that down on the form and submit that, and make sure that we have your primary care physician in for you and assign it for you to be ready to go. So again, we have other districts that are on this program. It's many other our customers around in the state are on this program. It's a great opportunity to provide some cost savings. The Navigate network is, as we described last week, in this geography, meaning northeast Wisconsin, is the same network as our Choice Plus network. The Navigate network around the country is not the same as our Choice Plus network, so there are some limitations as you move outside the rest of the country, where you would want to check on the website to see if a provider is in the Navigate network or not. But up here, in terms of primary care, the networks are the same. And we'll show you, actually, someone from your office, Joe, today, right after that call went out, I think it was Kathy, and ran just on her own, just went out to the website, pulled up all the primary care physicians within 20 miles, and it lists them all and gives you that MPIN number. It's very simple. So that's the Navigate program. You'll have, your office visits, as it mentions here, preventive care is covered at 100%. But in order to go to see specialists, you will be required to have that referral from your primary care physician. Are there any questions about Navigate? Yes.
Can you explain what you mean by that office visits are copay only? Does that mean that it doesn't apply towards your deductible?
That's correct.
So you go have an office visit and it's a $10 copay, and then the insurance company will just pay the rest of it?
That's correct.
Okay.
Yeah, the question is, with our program out here, we have the copay for an office visit, and the question is, does it then go to deductible and co-insurance? And the answer to that is no. You have an office visit copay, and does not go to deductible and co-insurance then, the way that it does today. It's paid at 100%.
Chris, could you just give an example of what that would be to make it more understandable?
Right, so the question from Joe is an example of that. So if you're going to the doctor for an office visit, and the expectation is that in the past that you would pay the $80 or whatever it would be for that office visit, plus your $10 copay, with United Healthcare you would just have the $10 copay that you'd be responsible for. Yes?
But the $80, say your office visit was $80 or $100, and you just pay the copay, but then it wouldn't apply to your deductible?
That's correct. So the question is, if there was more cost beyond the copay, would that go to your deductible and co-insurance? And the answer to that is no. It's just the copay.
So Chris, could you give them an example? If I go to the doctor, I have an office visit, and while I'm there, they do some lab work and take an x-ray. How would that look from terms of payment?
If it's lab and x-ray, yeah, the lab and x-ray would be subject to the deductible and co-insurance, but the office visit portion would not. The office visit portion would be the $10.
So we're saying
Yeah.
if we think we have our child has a cold or flu symptom or strep throat, we can go there for the office visit, and that will just be a $10 copay?
Yes.
Okay, I just wanted to, that kind of,
So what tracks to your deductible is lab work, x-rays, imaging, and inpatient and outpatient hospital care. You're going in for a simple doctor visit because you don't feel good, and you go in and they check you out and give you a prescription. You pay your $10 office copay, United Healthcare pays the rest of that bill at 100%. You would then go pick up your pharmacy.
And again, the new benefit is with the trust, our current plan is when you went in, you paid that $80, you had to pay the whole bill until you met your deductible.
Plus the copay.
This is a new benefit that we have before you paid your copay. And the copays have never counted towards our deductible with the trust or with UHC.
In Amber's example there, where she said taking her son in for a strep test, the office visit would just be the copay, but the strep test would go to lab, and that would go onto your deductible, or if deductible was met.
Correct.
But, yeah, just so you know.
And by the way, if you met your deductible, you would still have office visit copays.
Can I just add to Amber's question? In that scenario, if you have a child who you think has strep throat, there is the Shopko Fast Cares as an example. You would pay your $10 copay, and in the Fast Care arena, that strep test is covered into that office visit. It's not a separate. So in that situation, it's a $10 copay because they bill it as just an office visit, and it includes those labs. So you'll want to think about the right care at the right time for the right cost, because those Fast Cares in the retail setting typically have extended hours, evenings, and weekends.
I have a question.
Yeah.
Does that cover office visits for like a dermatologist and things like that too, or just
Yes.
just your primary care provider visit?
No, it's for specialists as well.
Specialists
You will
as well?
need,
Okay.
if you're in Navigate, you will need a referral to get to the specialist.
Yep. Okay.
Yes.
Is there a potential for a network provider to use contracted services that may not be in the network that we would then be liable to pay?
No. No. The physicians will refer to in-network providers.
For like pathology and?
Yes. It's not your, so the question was, will my PCP refer me to services that are outside of the network? No. The PCP, the primary care physician, will refer you to services within the United Healthcare network.
Chris, I don't necessarily mean that they would refer you to, but they may go off for their own contracted services. Will they get x-rays read or CAT scans or something that may not be a network provider, or a different group of physicians, maybe from out of state or something? I've experienced that before in the past.
It won't happen with us. So would the physician just utilize services that are outside of our network? No. No. These requirements are very clear to the providers of the expectation of how they are to refer and utilize services that have to be within the United Healthcare network. That's one of our contractual obligations, or one of their contractual obligations. Yes?
What if you are already under the care of a specialist who also, after January 1st, is a network specialist? Do you need to go back and get a new referral?
Yes, I think so. Linda, is that correct? Yes. Yes. The question is, if you're under the care of a specialist, of course, right now, you don't have the obligation to have a referral. And you're under care of a specialist, and as of January 1st, you want to return to that specialist, you would need a referral from your primary care physician in order to go to that specialist.
Chris, and this may be a Cindy answer for people, explain why it's important that we have people start using a primary care physician instead of self-diagnosing themselves and going right to a specialist. What have we found within our consortium? I think this is a Cindy answer as we went through this in the bidding process.
Sure.
Here's the why behind the what. 70% of the population in the United States self-navigates into specialty care. Of that 70%, 90+% could have been handled at a primary care level. And specialty care is 2 to 3 times the cost of primary care. So one, it's a way to try to wrap around, get the care we need and the cost structure that we need. And also, it's a way to put the primary care doctor back in the role of helping you to navigate your care. So it's a whole continuum, and when you think about how the medical system even started with primary care and specialists, it was the role of the primary doc to manage your care. So this is an effort to do that, and instead of the old HMO capitated version, you can cross into the network. So you see a ministry doctor, primary care, and you want to go into Aurora for a specialist, you can be referred to that specialist. You just need the referral so that it's calculated and managed at a different level. So some of you likely very much need to be in a specialty role, but I can tell you, there are people today that say my foot hurts and goes right to a podiatrist. I got a rash on my arm, I'm going right to a dermatologist. Most of those things could be handled at a primary care level at a much reduced cost. Does that help? Yes.
For those of us who see nurse practitioners or physician assistants as our primary health care provider, we would be listing for our purposes of signing up their supervisory physician.
Correct.
Is that
Yes.
correct?
Mhm.
Okay, and then the referral would have to run through your nurse practitioner and their supervising physician to get to a specialist, is that correct?
Yes.
Okay, but you are not discouraging people from using nurse practitioners or PAs?
No. So the question is in regards to nurse practitioners and physician's assistants. And of course, they're technically not a primary care physician because they're not a physician. So they usually, or they always are associated with a physician or physician's practice group. And so you'll actually be identifying a physician or physician's practice group that nurse practitioner or PA is assigned to. But no, absolutely not. We would encourage you to continue utilizing the PAs and the NPs of the world. And again, they're even more basic in terms of, or fundamental in terms of addressing primary care. And they're linked to whatever physician that they're assigned to is, they're connected to that physician and having those discussions and reviews with that physician about every encounter they have with a patient. So no, that's a great, you know, we're all going to have NPs and PAs that we're going to be seeing as more people come into the system with the new national healthcare program. So yes.
Clarification on Shirley's question. So if I'm seeing a specialist right now, I realize after January 1st I have to get a referral, but what if my specialist is not in the network?
Well, then that'll be a problem. The question is, what if I'm going to a specialist today, and as of January 1st, I realize I have to get my referral from my primary care physician, but let's say my specialist today is not in the network. If that's the case, then, and that would be unusual in this part of the state, that would be very unusual because of the breadth of our network. But if that were the case, the primary care physician will not refer you to an out-of-network physician. Okay? Yes, sir.
Would that be a situation that the Choice Plus plan would cover?
Yes. The question is, would that be a situation where the Choice Plus plan would cover? And the answer to that is yes. And I don't want to move off, I want to get to that in a moment. I don't want to move off and navigate here if there are more questions, but I do want to make sure that I cover Choice Plus so that you understand what that gives you in terms of flexibility and access. So, are there any other Navigate questions? Yes, sir.
Where does the chiropractor come in?
The chiropractor is not a primary care physician, so
Is your primary care would not be recommended chiropractor?
actually for chiropractor, you don't need a referral from a chiropractor. I need to check that. But
That's correct.
Yeah.
You don't need to go from there right to a chiropractor, can I be your
correct. Okay, let me make sure I, I'll rephrase that for you. So a chiropractor, due to state legislation and other, is same as any other illness, so you can go to the chiropractor without a referral, but you cannot assign a chiropractor as your primary care physician to obtain a referral from a chiropractor. Okay? Pardon? Occupational, OBGYN is the same way, yeah, I'm sorry. And we have a neat little handout here. I don't have it in the presentation, but we're going to make this available for you. 3 important things you need to know about the Navigate plan. You must select a primary care physician in the network. It'll explain that a little bit. You must get a referral from your primary care physician before you see another network or specialist. Referrals may not be needed to see the following providers: OBGYN, behavioral health, eye doctors, convenience care clinics, urgent cares. And you can change your primary physician 1 time per month. So there's a little bit of information on here, and we'll have these out there for you, along with some directions and some visuals here on how to find a primary care physician within our network and sign up for that. Yes?
So, it's along lines with the specialist, if you have to keep going back, like let's say it's every 6 months, do you need a referral every time or just for the first month?
The referral is good for, Linda, how long are the referrals good for? 6 months? 6 months or 6 visits for the referrals. And then they can be extended. So the question was, if I'm going to a specialist and I have to go back to the specialist 6 months later, do I need another referral? And the answer to that question is, with the referral that you receive, that's good for 6 months, and it's good for 6 visits. Sorry, I'm not the expert on Navigate, but yes.
I got a question, I think it deals with the number 2 up there, for network coverage only unless emergency. Say you're traveling out of state and you have a heart attack or you get in an accident and ambulance rushes you to the hospital, you have to go in immediate emergency surgery, and you end up in ICU. And what if it's not a network doctor?
So her question is, what if I just had the worst vacation in the world? And I had a heart attack, went into the emergency room, and then I ended up in ICU. Look, I mean, what we recognize is that this is emergency care, and you don't have choices. So you're not going to be penalized by us because you didn't have the choice of where you could go for a provider at the point of you're needing acute emergency care. So you would be considered in network, you would have coverage. Yes?
My nurse practitioner works for a gynecologist. He is in the network, so can I put him down as my primary physician or no?
No, I don't think an OBGYN can be assigned as a primary care physician. Yes?
Didn't you say that an OBGYN did not need to be a referral
That's correct.
along with the chiropractor?
Correct.
Now, does the chiropractor have to be in a network?
Yes. So the question was, to confirm, I don't need a referral if I'm going to see an OBGYN or a chiropractor, but if I'm going to a chiropractor, does that chiropractor have to be in network in order to have it covered by the health insurance? Yes. Yes.
Okay, so back to my question. It's all about me.
It's all about you, yeah.
I could put down my husband's doctor that I never see, but I don't have to have him refer me to my gynecologist because he's in network, correct?
That's correct.
So I could use someone that I don't really see as the primary one, just so I can keep going through my.
Right. So the question and let me make it clear that this is from a female, because she said, could I assign my husband's primary care physician for me? And the answer to that is, of course. But then I would go to the OBGYN where I do not need a referral, and the answer to that is correct, assuming the OBGYN is in network. Yes.
Is the chiropractor visit, would that be subject to the deductible, or would that be the office visit?
Chiropractor is the chiropractor, is that just the office visit copay? Yeah, it's the $10 copay.
Yeah.
Chris, I thought I read a change on where the primary care physician would have to be located this week. Last time you said it had to be within this region, so if I had a child in Madison, I thought did I read something today? It's the whole state of Wisconsin, as long as the primary care is within the state of Wisconsin, then they could have a primary care doctor in Madison now, and not here in Sturgeon Bay or Green Bay.
Yeah, the question that Joe was pointing out here, and let me make a few points about this, is does my primary care physician have to be here in Sturgeon Bay or within this geography? And particularly as we're thinking about dependents that are outside of this area, but still in the state of Wisconsin. Here's how I would answer that, and it's not quite that simple. The easy answer is, or the simple answer is, you could have any physician, primary care physician in the state. The qualifier that I want to make on that is that on the northwest part of the state, so if, I'm trying to think, I'm not from, of course I've lived here for 33 years, but I'm trying to think of what are the schools.
Superior.
Yeah, Eau Claire and Stout. There's a slice of Wisconsin in the northwest part of the state that is not part of, that does not have Navigate yet. And that would be the, I think Eau Claire is in that, definitely as you get closer to Hudson, and Stout would not be in there, Black River Falls, is that a university? Whichever Stout is, I don't know. Anyway, as you get up there, there's a little, that's a little fuzzy. And in Madison, the answer to your question, you could. The problem that you're going to have with Madison is that we do not have many providers in the Madison area. So you won't find many primary care physicians with us in Madison. So, I mean, I would encourage you to, but theoretically, that's correct, anywhere, but if you had Green Bay, of course, Sheboygan, Oshkosh, central part of the state, Milwaukee area, Racine, Kenosha, Janesville, any of those other areas, Beloit, we have physicians in many of them and many primary care physicians. I would just say that it could be that I think for most people, even what our experience with our current customers that are on Navigate is that even with their dependents, their primary care physician is typically back in the area where they reside or where they grew up, where the rest of their family is. But you'll see when you go out to the website if there's a primary care physician on the Navigate network in that geography and they have an MPIN number, feel free to assign them if that's who you want. Any other questions about Navigate? Yes, ma'am.
I'm concerned is if you were referred, they would refer you to a network doctor, you're saying. But
Yeah.
for example, is there no network doctors to be referred to at University Hospital Madison?
Correct. Question is, if I was being referred to, what if my doctor were to refer me to the University Hospital, University of Wisconsin Hospital physicians? And that won't happen with us because UW hospital system is not in the United Healthcare Navigate or the Choice Plus network. so they wouldn't refer you to UW. Now, possibly, I will make this one distinction here, a transplant or a very complex cancer situation. They could utilize a very highly specialized United Healthcare network, which is our transplant network, and UW isn't the United Healthcare transplant network. So if it was for something like that, you could be referred to UW, but not for any other even highly specialized conditions. You would go, they would direct you to an in-network provider. We can come back to navigate here, but if it's all right, I'll move then to what the Choice Plus plan represents. So Choice Plus will look very similar to your current arrangement, except that you have out-of-network benefits, and you won't need a referral from your primary care physician. So there's no referrals. You'll have out-of-network coverage. You can make your own decision to go to a specialist, and you will have the same copay and the deductible levels in network, and higher deductible and coinsurance levels out of network. From a financial standpoint, in terms of your contribution, of course, we showed that, and I can go back to it if you need to see it. The district makes the same contribution that they would make to you on your behalf as they would for Navigate, and you would have to pay the additional buy-up for the Choice Plus plan. Are there any questions about Choice Plus?
I have one.
Yes.
But then the example of like UW Health in Madison, if you're in Choice Plus, would be considered a non-network that you could go to?
Yeah, the question is, with Choice Plus, with the example that was brought up earlier about UW Madison, even though they are not in the Choice Plus network, the UW system is not, they would be available and to you as a covered benefit, as an out-of-network covered benefit. Yes. We've got a lot of great providers. Unfortunately, at this point, we haven't reached an agreement with UW on what represents the best value. So that's Choice Plus. How do you find a provider in our network? And if you're in Navigate, how do I find a PCP in our network? I think I brought out before there was the handout that on page 6 on how to get to a provider. I'm going to go out there right now. Last week, as you recall, I was unable to get out there, and I think I figured out why. It wasn't that our website was down, but if you go to myuhc.com, which is the website for all members of United Healthcare, of which I am one as an insured of United Healthcare, I can, as you see where the cursor is right now, I can enter my username and my password, and I'm logged in. It opens up, and we're going to discuss a little bit about all the great information and features that you have through myuhc.com, but you don't have to log in to myuhc.com or have a login number to have access to some great information. So, if I take my cursor, and you'll see, so that I don't leave the podium here, and you go to the top right corner, I note that I have not logged in, and it says find a physician or a facility. Oh, no, here we go. Now we're going to be able to go. Last week I just wasn't sure how to do this. Takes you to this, and what?
I don't know if you'll be able to from there.
Yeah.
Thank you.
I learned. That's what we're here to do, learn. So it distorts it a little bit, but what this is giving you then is you have to select, it says select a plan. So if you're in Choice Plus, you go to Choice Plus, and if you're in Navigate, you'll go to, in your case, Navigate/Navigate Balanced, okay? Click into that. Gives you specialties, facilities, and conditions, as you can see. You'll want to select primary care. You go to primary care. Whoops. In Navigate, around the country, we have 166,329 physicians that are primary care in Navigate. Of course, you're probably not that interested in that many, so what is our zip here? 54235.
5423.
I have it?
Yep.
So let's see who's up here. Here are some physicians that are in our network that are in Navigate. And notice right here, see my cursor, that's the ID number that you need to put on the form with their name to select a primary care. It's that simple. And I got this little bar here. So if you want to take this, where are we, just short of Green Bay, right? Green Bay, 40 miles? So short of Green Bay, I can get you up to 152 primary care physicians. And if I take it all the way to Green Bay, 322. So that's how easy it is to find primary care physicians on our website. And we list them here with, they don't come up actually in alphabetic order. The way they come up are based on an internal designation that UnitedHealthcare has a program called a premium designation program. It's not a separate network. It's just if we have enough data on the physician, we evaluate how they practice, and if they're a high-quality physician, they'll have at least 1 star based on our measurement of them, of their performance. And if they're high quality and efficient, efficient's kind of a fancy way of saying economical, that there's value there, that they practice medicine over an episode of care, prescribe mainly generic drugs, and don't overutilize tests and that sort of thing. If they provide care efficiently, then they would have 2 stars. So 1 star is quality, 2 stars quality and efficiency, and that's how we identify within our network. So you can take it down to 1 mile, or you can take it out to as many miles as you want to find your primary care. And it's that simple. And then if you want to be looking for other specialists in here, or it's important to you to have the qualifier of gender, you can look up in multiple ways, and sort in multiple ways. Or it's that, let's say you have a child in where my office is, down in the Milwaukee area. This will probably blow it open here, because if you have a child down at UWM or something like that, so we have probably several hundred, so 1,000 within 10 miles of Wauwatosa where my office is. So very simple to get out there in terms of finding, but remember, what was important there is that I needed to know what network I was going to. So I've expired by not by trying to take it backwards. So I have to know what network I wanted, and I need to know what, I needed to know what the, and I could have picked the navigate or navigate balance, or if I was going choice plus, I could have picked choice plus. So that's how you get out there. Actually, you can kind of create your own directory. Someone in your, as I said, it was Kathy here earlier today, had gone out and just, had just created her own little PDF file of, I thought I saved it down, but I didn't, but there was a PDF file of providers within 20 miles of Sturgeon Bay. So, quite simple. So that's how to find a provider. Again, it's in this handout, it's in that multiple page booklet about your health and wellness, page 6, and it directs you out to MyUHC. And even though you're not registered with MyUHC yet, and you won't be able to until you're actually having your enrollment information in, you can go out there and start looking. One of the things that we discussed earlier was last week with the change when you go with a pharmacy. And with United, our pharmacy network is very expansive. All the major chains and most independents are in our network. In order to have your mail order uninterrupted care, I had that envelope that you would need to complete. The good news was you complete that, we'll make sure you have uninterrupted mail order. The bad news was that you'll need a new prescription from your physician. And of course, that mail order copay will be 2.5 times versus 2 times. I mentioned the drug list. The drug list is different when you change carriers, insurance carriers. So when we all make our own arrangements for price points and volume purchasing and negotiations with drug manufacturers to make our own arrangements. And what that unfortunately means for you is sometimes there's some disruption, meaning that you might have a drug today in Tier 1 that you're taking, and in our plan, while you need to look at that list, it might be in Tier 2 or Tier 3. Or it could be the other way. It could be taking a drug today that's in Tier 2 or Tier 3, that with us will be in Tier 1. For every drug classification, we will always have at least one option in Tier 1. So if it's not your drug, but it's a drug that's similar to the one that you're taking, you could have that discussion with your physician about looking at an alternative in Tier 1, if that's how you would like to do it. But I encourage you to take a look at that drug list because it will be different than what your current drug list is.
Excuse me.
Yeah?
Is that also accessible without a membership number? Can I look at those right now?
We actually gave that in the packets last week. We had a printed copy of all that. There is a way to get out there but this particular list, because what we did for the districts and the co-op is a less disruptive list. The standard list that's on that website for United Healthcare is one that has more, we have more flexibility in making those tier adjustments and placements. And to provide you with a less disruptive program, we will only make tier changes one time a year, and that list is not out there on the MyUHC regular access. So you look for the printed list, and if you don't have it or need another one, we'll get one for you.
One other question on that. What, one chart I looked up on this said may be excluded from the program. Maybe excluded.
There are situations where we exclude drugs from our drug list, and there are times that we make exceptions to that. if you want to discuss a drug that is listed there as may be excluded, we can, we'll check that out and let you know whether it's excluded or not. Yeah. Yeah. So, yes, ma'am.
If you are on a prescription for, say, blood pressure, and you've gone through a couple that haven't worked for you, so for sure you want this specific one, can you write on, when you send the prescription in, no alternatives, or it has to be dispensed as written? Do you have to do that?
Yeah, the question is, if you have the drug that you've checked, various drugs, and the only one that works for you is this particular one, and then your physician writes that prescription out as dispensed as written.
You have to write that when you're sending it in.
You write that in,
On the form that when you're sending the.
oh, you're talking about for the mail order?
Yeah, when you're sending that in, because you don't want to get the prescription that didn't work for you.
Yeah, I was just gonna say, so if you have dispensed as rate, when you complete the mail order information, it's gonna be specific to that drug. So we're not going to, we're not going to make a change of that drug on what you send in for the mail order. So if on the mail order form you complete it and you have this drug, that's the one we're going to fulfill for you, and particularly with the prescription that we have. Remember, we need a script. So we're not going to substitute it with a generic or any other drug. Is that clear?
Yeah, when you send the form in for your medical history, I think it's called the HMQ, that questionnaire, do you do that for each member of your family? You have to make copies and do one for each member, what their allergies are and their history?
If they're all getting drugs through the mail order, yes.
So you make copies of that form then?
Yes.
Okay.
Yes.
Can we go on the website and find out what pharmacies are network pharmacies? They have to be a network, right?
Yes.
And can
Yeah,
we find that
yeah, the
somewhere?
pharmacies are out there. Yeah, the question is, it's really hard to imagine that there'd be a pharmacy that's not in our network. The question is, can you go to myuhc.com and find our pharmacy, network pharmacies? Yes. The answer to that is yes. And we have a lot of pharmacy networks. There are a lot of pharmacies in our network. You have to look. But, you know, as soon as I say that, there's going to be one in Sister Bay that's not in the network. So I don't want to say it would be best to go out on the website to check that out. Okay? For those unique situations where you have the need for a specialty pharmacy, what we're going to encourage you to do is make that connection once we have all of your eligibility information in and we have it in our system. Make that connection with the pharmacist and actually have the conversation with our pharmacist to make sure that we're addressing your needs from a specialty standpoint. Specialty drugs are those drugs that are typically some very specific illnesses, MS, certain cancers, and of course hepatitis. And with those drugs typically arrive in a very controlled environment, meaning they may have to be refrigerated, they may have to have sealed in other ways. So we make and they're very, very expensive drugs, so we make very specific arrangements with you for when we deliver have those drugs delivered to you, and make sure that you're in home for those and they're not sitting out on the porch or in your doorway or in your mailbox. So you'll see information on how to connect with us. We spoke about the ID cards before, and the ID cards, as I mentioned, are 2 per family and 1 for single. And if you need more, we have many ways to get additional ID cards. You can call us and say, I need more than 2. You can go to the website and log in on myuhc.com and push a button and they'll send you some ID cards. to whatever you need. And if you want one right now, not right now tonight, but when you remember and for some reason you lost it or you have the need to get one to a family member, you can go to myohc.com and print off of there an ID card. So they're very easy to get at. I think as I showed last week, they are plastic. You'll have the name of your dependents will be on the ID card. And it is a combined medical and pharmacy ID card. Dental will be a separate card, and dental does not list the dependents. Okay? But here's your medical card. It's got the magnetic strip on here. Medical, pharmacy. Oh, and these will be mailed to your homes.
The member ID number, is it social security number or is it an encrypted number?
Yeah, the question is the member ID number a social security number? And the answer to that is no. It is not an ID number. And these will be mailed in time for you to receive them pending the performance of the Postal Service before January 1st. Okay. So we'll be mailing these before Christmas. We spoke about myohc.com. I'm going to go back out there in a moment because I want to show you a couple of items here. And again, I'm going to actually log into myohc.com on my login and just give you a couple of real quick refreshers on what you can do out there. But it has your claims, your explanation of benefits, chat with a nurse, any one of a number of programs out there like the personal health record. So we are keeping a personal health record on your behalf, accumulating information on your encounters with the medical system on one source document that if you need for personal reasons you'd like to see what your status is in terms of the last readings on your lab work, the last physician visits, what scripts you've been taking on a historical basis. It's going to be contained in your personal health record. And if you decide that you're going to see a new physician at some point and you want to give them your history, once you have that history with us, you'll be able to print your personal health record and share that with your physician. Extreme examples of the value of this are disasters. Katrina, and I'm sure when Sandy, when all that is shared with us here internally, our company, and we take pride when doctors' offices are shut down, and their records are washed away, when homes are destroyed, and people don't have an idea of how they're going to connect the dots on what their care has been and what it should be. And with Hurricane Katrina, we printed off in Houston thousands of personal health records for people that they could take back to their physicians and have that history of what their medical care was in one spot. It's a great resource. We also have out there, well, actually not out there, they are out there, but we'll have health statements for you. So when you have an encounter with the health system, you will not get an explanation of benefits sent to you with every doctor encounter or medical care provider encounter. It will be out on the website that you can go out and look at an explanation of benefits, but what we are going to send to you, if you utilize the plan on a monthly basis, is a health statement. And it is simply a summary for you and your family of your encounters and what the financial impact of that is. And it will be sent, if you are going to the physician, you'll get one of these every month that you have, that you've had care. If you don't use the system, you don't get anything from us relative to the health statement in the mail. So this is a great summary. It's designed to read in a very simplified way to connect the dots. We have also through our website online coaches and other wellness information, and we discussed this last week as well. I only put this out here so that you're aware that these programs are available day one, or January 1st, if you have an interest, and we encourage you to really explore and take a look. But what you're going to see from us is, in conjunction with Cindy and her team at M3, we're going to be collaborating on a more strategic approach to roll out a number of wellness activities on your behalf in a way that will really be promoting and creating incentives to get your participation in those. So stay tuned for that. You're going to see more from us. I spoke about, the last time I was here, Nurse Line and Care 24. It's kind of the same combined within one program. Let me just give you, as I did last week, some examples of the value of this, because it really is underutilized, tremendous high value program. You have an acute medical situation, and you're not sure whether you should be going to emergency room, urgent care, or just how to deal with what you're faced with for yourself, for your child. Call United Healthcare 24 hours a day, 7 days a week, and you're going to get an RN on that line, a registered nurse, and have a discussion to walk you through this. And I think the example I gave last week is one that is very relevant to me as I think about a holiday next week, because by the way, the big game's this Saturday. I'm a Buckeye, so I'm from Ohio, and my father was visiting us from Ohio 2 years ago, and on Thanksgiving morning, a holiday morning, he collapsed in my kitchen, fell to the floor, and lost consciousness, and he regained it instantly. You know, it was just a momentarily lapse, and was laying on the floor, and he says, "I'm okay, I had a diabetic shock." And I said, "Really? Because I don't understand, you were doing great, and you're telling me all your readings were good." And we called Nurse Line. And she stayed on that line with us for almost an hour as we went and had him tested with his glucose monitor and all of the readings that he did. And he did not have the diabetic shock. 3 weeks later, he had quadruple bypass surgery. So, but she said, "This is not a diabetic incident. You need to get him to the hospital right now." And so that's what we did. And that was on a holiday, and he wasn't a member of United Healthcare. I was. I called the number, and I got somebody that knew what they were talking about right then. This could be something like that. It could be something less severe. It could be that you just got a diagnosis, or a family or friend got a diagnosis, and you want to just have a discussion with somebody about it. Call Nurse Line. Let's say it's not about an acute medical situation. Let's say I'm pretty stressed out because of financial or legal or some other issue that's going on in your life where you would just like to have that kind of encounter and have a discussion with someone. If you call us through the Care 24 program, you'll get a master's level counselor answering the phone to have those discussions. And the example I used last week is a coworker of Linda and I's, who this summer, father-in-law, unexpectedly died at a relatively young age, had a spouse, surviving spouse. They were paralyzed. They did not know how to deal with it. No one expected this. They called, they got someone that was able to help lay out a plan to deal with it, to take advantage of community resources, not even through the health plan, just a resource. So legal advice, you can get face-to-face visits with doesn't go through the medical plan. Really encourage you to look at that program, and that's built in here. We also have the behavioral. We don't overlook the more behavioral, substance, and mental issues that you or a family member might have, and through that we have our United Behavioral Health Network that is built in the way that you would expect to have that coverage, similar to what you have here today. But we have a different network of behavioral health providers. I also mentioned taking advantage of the buying power of United Healthcare and all of our employees and all of our members. And with that, you're able to get discounts, meaningful discounts on purchases for things that are not covered by medical plans, like teeth whitening, like LASIK surgery, nutritional supplements, some clothing, all of that can be accessed, and you can get some discounts from the United Health Allies discount program. We're gonna hand you an ID card, and you can call us, and you'll get treated with respect from the people at United Healthcare, and they'll help you find a physician, they'll help you address whatever claim question that you might have, and they'll help you determine what costs you might have in the system, what you could expect. But not everybody these days they do everything telephonically, and United Healthcare has put in place some award-winning higher tech programs like the Health for Me app that's available on iPads and Androids systems and devices to get information about your medical care through these systems as well. So your ID card can be out there, you can get estimated costs, you can find a physician, all on the Health for Me app. I can show you that afterwards. I'm on it. My ID card is there. We had someone in the office who's, as I said last week, they put their ID card on here, they went to the physician's office, and the physician's office person took it and made a photocopy of their ID card off of their phone. Where I could just stand there and email it or fax it to them right from my phone. It's a great way for the way things are moving today for a number of people. We also have a phenomenal tool which is to help you estimate costs based on your plan, specific to those providers, that you can go out to myuac.com and get that kind of information readily available to you. Phenomenal tool, again, to be able to go out there and get cost and quality. I think what we had on there were the 4 Ps: price, procedure, provider, place. So that's me logged in. My deductible is a little bit different, and out of pocket's a little different than yours. I can go in and you just click in, you look up claims, benefits, find a doctor, get your scripts. Once you're logged in and have a password, which you can't do until you actually have your eligibility, you won't have to select Choice Plus or Navigate. It'll be in there for you. They give you a nice little hello, and your plan benefits are in there, pharmacy scripts, claims, accounts, all of it, my personal health record, which I'll spare you that. Not a lot of detail on it. You want to print an ID card, you want to send a new ID card, all of it are out there, and then that great tool of being able to estimate what costs are going to be for procedures that are out there. So it's really been a well-received tool for us. So that's kind of, and then let me, I'll come back to that here. If anybody wants to see something after we get done, but let me just wrap up this part of it. Procedure, provider, price, place. 2 last things, and that was what we also brought up last week when we were up here. And don't want to overlook this because they're really important for you. You're going to have a dental program. So the dental program will be very similar to what you have today. There will be an in and out of network opportunity for you, but the cost share is the same both in and out of network. So I encourage you to you'll reach your out-of-pocket faster if you go, or slower, I should say, if you go an in-network provider. So we encourage you to take a look at that. The dental program has 2 really nice features. There's been a link determined to low birth weight and preterm, high prevalence of preterm for women with gum disease. So if you are pregnant and you want to have another dental exam, we'll pay for it at 100%. If you're in a high-risk category for oral cancer and need a screening, you're an adult, we'll pay for that. There's no cost. And in addition to your dental program, We also mentioned the vision plan when we were up here. There's an eye exam built into the medical, but with the vision program, you have a more expanded network of vision providers, eye care, but more importantly, you get access to discounts, significant discounts for your frames, for your lenses, and contacts. So encourage you, we were up here describing that last week. And then for employees, you would have access to critical illness and the accident programs that we mentioned last week. And we'll be back to cover more detail on these, but just remember, we have that $100 wellness benefit that if you were taking advantage of some things you're probably already doing today from a wellness standpoint, the cost of these programs could be covered by just the check you would receive from us on wellness. We've covered a lot of ground here. We want to open it back up for any other questions that you might have, but we know that when we leave there, and even with an FAQ, frequently asked questions, there might be other questions that you will have. And when you do that, by the end of this week, we'll have functional here an 800 number that you'll be able to call and to United Healthcare, and even though they don't have your name in our system yet, if you identify yourself as being part of the Door Kiwani School Co-op, you can't say I'm Sturgeon Bay School District. You have to say you're part of the co-op. But if you do, they'll know who you are, they'll know what kind of plan you have, they'll be able to describe the benefits to you, and if you want to call them to help look up a provider, they'll do that for you, and we'll be ready to take over for it. So, yes.
Where can we find a list of frequently asked questions?
We are compiling those as we speak because we're finding out what those frequently asked questions are by the meetings that we're doing this week. So,
we will post them when we get that PDF on that Skyward spot where we're posting all the other information.
No, it's on the school website.
Our school website, sorry.
Kathy Eckers, right?
Yes.
yeah. So we wanted to make sure we had, United has some frequently asked questions, but we wanted to have more specific to the Door Kiwani Co-op, and we've got some great questions, where we received some great questions this week, so we'll put that together. Yes, sir.
Will there be an open enrollment period 6 months from now I sort of asked this question last
You did sort of ask that, I remember that.
and I'm just wondering because I talked to Joe and he had a potential answer, I just want to hear it.
Well, now that I know you talked to Joe, I'm not going to give you my answer. You will never be able to get out and navigate. It is your destiny to be and navigate. We are reviewing that right now. Joe has an idea on that, but I have probably a more definitive idea because I had the conversation with the underwriter today about it, and so, but I don't want to lay that out there for you until we've had more discussions with everybody here. So what's likely to happen is that, well, we'll have to lay that out. It'll be at least 6 months that you would have to be in the Navigate program, possibly for a year or 18 months. So we got to figure that out.
That'd be the same for like if you take vision too, is that?
Vision would be on an annual basis.
So it's open enrollment,
Oh, the vision would be in whatever enrollment period that we lock down here. So it's either going to be 6 months, 12 months, or 18 months. We have to figure that out. Sorry that I don't know the answer to that, but...
But the issue is, there's 9 school districts that
Yeah.
have to come to that decision, I'm
Right.
sure, and we're still negotiating. Obviously, Cliff and I had a conversation, I would love to see a July open enrollment
Yeah.
date again,
Right.
knowing that this is a big step, and some people
Right.
may choose Navigate and want to say, yeah, you know what, I'd rather go back, or
Right.
some may say, you know what, we chose choice and I'm paying that money, but in reality, I haven't used a doctor outside of the network, why would I pay that money and then be stuck with it for 18 months? So, but
And-
because 9 districts are involved in that decision, we're not there yet.
And I want to make it clear that we hear we're getting the voice of the districts here, and so we're not being insensitive to that, and I don't mean to be glib about it. It's kind of fun to be glib about it, but I know it's important, and we've had, but we need some, there's some unique characteristics to the 9 districts coming together here that really worked in your favor in terms of financials, but leaves a little bit of work-throughs on some of the other details. Yes? Yes?
I have 2 questions. I know everybody has their own health history and things like that, but from your standpoint, what do most people lean towards, prefer? What choice, the Navigate or the Choice Plus? What can you
Yeah, sure.
suggest one over the other?
Yeah, that's an easy answer. The question is, what, obviously healthcare is an individual
Yeah.
decision here, an important decision. It's your health, it's your money. What do most people do when faced with these options of dual choice in here with United Healthcare? We see people taking that.
Okay.
And mainly because our network is so expansive, and as long as you're not really missing any major provider system in a network, we find most people just are willing to accept that primary care. Look, that's not a bad thing. I mean, going, as Cindy described earlier, directing this to the primary care is encouraging you to have a relationship with a primary care physician, and since we're taking the risk on your claim experience, that makes us feel better because we know you're getting direction and from that primary care physician to those specialists. And as Cindy described, a lot of care go to specialists that could be dealt with at the primary care level.
Okay. And the other question was, what's the difference between the critical illness and accidental insurance coverage and like short-term disability or long-term disability? What's the difference between that?
Yeah, well, short-term disability is really more of an income replacement vehicle, whereas the critical illness and the accident are designed to give you more like lump sum payments, I believe.
Yeah, and that's correct. The short-term disability and the long-term disability are really going to apply to any type of disability. The critical illness and the accident are going to be lump sum payments that are based on what happens. So if you are diagnosed with cancer, you may or may not have to be out of work for that, so you might not collect your short-term disability, but you're still going to get a payment from the critical illness. Same thing with accident. If you break your leg, you may or may not have to miss work for that, so you might not collect on your short-term or long-term disability, but you're still going to get payments from us, or a payment from us on the accident if your leg is broken due to an accident, which I can't imagine any other reason you'd break your leg. Does that answer?
Mm-hmm.
And I just want to follow up. We have not changed our short-term and long-term disability or long-term care. That has not changed. The one question I did bring up and said that we have a big decision to make is the long-term care. We've made no changes to the short-term disability or long-term disability. In fact, it's still with, all 3 of them are still with the trust and will be with the trust until July 31st, for sure. So those are just add-ons. I want to make sure that you know that those still are there for us and our coverage within our contract.
And what happens after July 31st?
Well, we have decisions to make on that, whether or not I think there may be potential of going with a different provider for that July 31st. Long-term care is a big issue. It's a huge expense, especially since we no longer have the trust. That one, I can't guarantee our district will continue, to pay 100%, and whether our employees will want to pay a percentage of that benefit. It's a $200,000 a year expense for the school district with the new increased cost coming January 1. So that is a big decision for the district to make, whether we continue to offer long-term care. And it's one of those deals is if we offer it and we say, well, we're going to cost share it out with the employees, so if you really want it, everybody has to pay. A percentage of our employees will not want to pay $50, $75, $100 a month out of their paycheck, whether they want to or not. And we may have a percentage of people saying, hey, I don't want that. I don't want to pay $100 a month or $50 a month. Many districts have found that their employees have said, no, forget it. I'm not willing to pay $50 a month. Percentage of people will, because you're at the age where it really matters to you and it's on the forefront of your decision making. Many of our people, it's not even entered their minds. And then it comes down to those kind of decisions. But it is a huge expense for the district, and it's gone up dramatically over the years, and now because we're no longer with the trust, it's jumped even higher. So that's the big decision that we'll have to make by January or July 1.
One clarification on the accident and critical illness. It is considered gap insurance. It does not coordinate with your medical benefits. It does not care what your medical benefits pay. The critical illness and the accident benefit pay you directly a lump sum, and what you do with those dollars is you check. Don't listen to United Healthcare, but you're all familiar with the Doc Aflac, and you've seen those commercials. This is just United Healthcare gap insurance.
I'm just playing around a little bit here with the, you got knee surgery and what you expect to pay and how it is represented with your own plan. In this case, my plan, yes, sir. So, you know, how much would be out of pocket for me, where I could go, how long it would take, step by step, what are the costs, how long it would take. It's really been, and then you can break it down into each step along the way, and how much that will affect your out of pocket, and how much it affects, expense. You start having some of these procedures, and you really want to know, and this is by providers. So it's telling you smart choice MRI. This is down in my area. Open MRI at Delafield, what it would cost. So, what other questions? Yes.
This goes back to the Navigate program. If I assign my daughter to a PCP up here, pediatrician, and she has a sore throat or an ear infection or something, I call and her pediatrician's not available, the other pediatrician is, but I have to get a referral from her.
Other pediatricians?
Right, to see the other
Yeah.
one, even though they're both in network.
Yeah, the question is, so, my daughter's not in the area. She's in the area, and I need a referral from a pediatrician. My pediatrician's not available, but I need a referral now, or I'm anxious for one. And they practice with another pediatrician that's also in the network. Yeah, they're able to use that.
They don't need no, you wouldn't need a referral for that. If it's his partner, or the same tax ID number, you would not need it.
Right, so you want to check, but typically you have if they're a part of a partnership, they bill under the same tax ID number, and as long as they bill under the same tax ID number, we would accept a referral from anyone in that office. Yeah.
Okay, so I have a daughter in Milwaukee, and if she has stomach ache or whatever, she goes to the doctor there that's in network. She doesn't need a referral to do that, right? As long as they're in network, or does she need to see the doctor up here first?
If she's in Navigate, she would need a referral from her doctor.
So does that mean that she can just call the doctor and say, can I visit this doctor in Milwaukee?
You know, if your doctor is okay with that, then they would allow that, right? Yeah. So if your doctor is okay with that, and probably would be, because you've assigned that physician as your daughter's primary care physician, they would know that she's in Milwaukee at school. They could make a referral to a in-network provider in the Milwaukee area for them.
All within a short amount of time?
Yeah.
But if it was urgent care or emergency
Well,
care,
yeah.
remember, that is just your copay.
Correct.
So in that case, your daughter has appendicitis happening, she's gonna go get either urgent care or emergency care. That doesn't need referral, that's urgent and that's emergency care. So those copays still count.
Right. So if it was something that she was scheduled and wanted that, it wasn't an acute, but yeah, they could arrange it.
They can just call?
Yeah. Yeah. Yes.
How does, like, state agencies play into this? Is there anything that you won't cover because it was going on before you signed up for this plan?
Yeah, the question is, are there any pre-existing condition limitations or that would affect you on an ongoing basis with this Navigate or with Choice Plus or with United Healthcare? And the answer to that is no. I mean, if you're on the plan here today, there's no pre-existing condition. limitation.
How soon can we use this phone number to ask for some plan benefit, or get some answers to that? Because we have 1 week to make this decision as far as between the two different choices.
Yeah. The question is, how soon can I make that call out to United Healthcare? I think the reality is, I think this is actually up and running already, but I'm not positive. I think they told us by the end of this week, so 2 days from now. Today's Wednesday, by Friday, you can call. Now, we provided other information, summary information. I mean, you've got a lot of detail, but don't hesitate to make this call out there as well. If you want to look, have them help you look up a provider, you can do that as well.
I'm specifically concerned about durable goods, i.e. insulin pump sensors. Is that something that your company will cover? That's why I have to make a phone call. Insulin pump sensors. It's a durable, it's something you change every few years.
Yeah. I mean, we've got durable medical equipment is covered. I mean, specifically, it's insulin pump sensor. I don't know. But yeah, there'll be an answer to that question. Yes?
When you talked about the vision and the dental, those are separate little insurances for employees. Would retired teachers or employees have the option to also have dental and eye or vision at their expenses?
Yeah, the question is, will a retiree be allowed to have vision and dental? Currently, you don't, but with us, yes. So what would happen is if you're being billed by the district, or if the district's paying your premium today for your medical, but you would like dental and or vision, you can take those with us. We'll bill you directly for those. If you're a direct bill and you want vision or dental, we'll just add that to the direct bill. But yes, as a retiree, you would be able to select one of those, or either of those programs. And a retiree cannot select critical illness or accident. Those are limited to strictly active employees. Yes?
Can I just talk a little about the vision coverage? When will we know if some of these will contact have been confirmed with her?
So, the question was, last week I talked about the Vision Network, and afterwards people gave me recommendations for providers that we wanted to reach out to. I have sent those off to my recruiting team. It usually takes 1 to 2 weeks for them to make contact, get in touch with the correct person, and then start the process. So as soon as I start hearing back, I will feed that information out, and then it'll be available to you. But I would anticipate it's going to be at least another week or two until we have more answers on that.
And I think we were going to be looking to have a return visit, or we can talk about it after the meeting here. Sam's here, but we might make arrangements for a return visit for Sam on this, specifically to the critical illness, accident, dental, and vision program within probably right after Thanksgiving. Yeah?
You said you needed to use a dentist that was in the network, and I'm assuming I can go back to the website and find out if the dentists that are in the network?
Mm-hmm.
Correct.
Yeah, you don't have to use it in the network dentist. Go ahead.
Oh.
Yes, there's both in and out of network coverage on the dental, and the co-insurance is the same. So it's 100% for almost everything but ortho. So the only reason you'd want to use a dentist in the network is because they have to abide by our contracted fees. So if you go in and get a crown, your dentist that's not in the network might charge $1,100. In network, it might be $700. So you're going to get more bang for your buck, and you're going to be able to get more in your annual max. If you want to look at the network, it's myuhcdental.com. So that you can go out there, and I think there's actually a link to it from the myuhc.com site as well. But I always go through it.
Does the same go for?
You can't jump in without raising your hand. I mean, this is a school, in the auditorium.
If you call that question number, and you say Dorky School Co-op, is all of the schools that are Dorky School Co-op would all be on the same navigation balance plan?
No, not every one of them will be. I mean, that's how, they'll pull it up for you initially that way, and then you'll have to be more specific about what district you're in, but don't lead with that information that you're in the,
So you mean some other districts might have a different plan?
Well, the only two plans though are, some districts have just choice. So Sebastopol right now is gonna wait till July before they go to Navigate. So their employees are only going to the Choice Plus. Southern Door is the same as us. They're going to Navigate and with the buy-up to Choice Plus. But it's the same Navigate plan for
Yeah.
all 9 districts, and it's the same Choice Plus. There's 4 districts, I think, are going to Navigate with the buy-up, or 3? 3.
for January 1st.
For January 1st. All of them have promised, as part of our process, that July 1, they're all going to Navigate. 2 districts can't go out of the trust until July 1. So two of the districts will still be with the trust until July 1.
It's a little, it's a little bit complicated, but as we get it all together, and once we're off on January 1st, and then by July, we'll have everything, more.
This is a one-year contract, right?
No, it's not.
Longer?
Yes.
This is an 18-month fixed rate, so in reality, for the next 18 months, you know what your fixed costs are.
Correct.
And then at the end of the 18-month, I think many of us assuming we're going to be with UHC for 3 years. We have a cap of 12.6 max, year 3. Our district has potential of 4% discount for next year too, doing the wellness stuff. Us and Algoma. The rest of the districts only have a 2% possibility.
But there'll have to be modifications for the Affordable Health Care Act, beginning of whenever, early 14, or you don't know?
Well, a lot of what you need to comply with that has already been built into place, and there isn't, at this point, there isn't a lot of drama to that in terms of this plan that we've got put up here for you. We've already conformed to a lot of those requirements of healthcare reform in anticipation of full healthcare reform in action on 2014. So, if you have any questions, still we can address them. If you want to wrap and then come up and ask us questions, if it's on a more personal level about a drug or this question you have, or if you want to see how I wasn't taking a phone call up here, if you want to see how the website or the apps work for the drug, right? So thank you.